You look in the mirror in the morning, brush your teeth, but when was the last time you took a close look at your tongue? If you are over 60, this inconspicuous organ can reveal more about your health than a whole stack of blood tests. In fact, your tongue is often your body's first warning system, and it warns you quietly before serious illnesses become noticeable. A thin white coating? It may seem harmless, but in seniors, this is often a sign of incipient gastrointestinal disorders or a weakened immune system. A British study from 2021 showed that 70% of seniors with chronic gastritis also had noticeable tongue coatings, usually long before symptoms such as stomach pain appeared. And what about cracks or grooves in the tongue? Many dismiss this as a sign of aging, but deep grooves, especially when combined with burning, can be an early warning sign of vitamin B12 deficiency, a silent nerve destroyer that promotes numbness, muscle weakness, and even dementia if left undiagnosed. Or maybe your tongue is unusually smooth, almost polished. Be careful. This can indicate iron deficiency, and this is widespread in people over 60, especially women. Without enough iron, your body becomes tired and susceptible to infections, and your tongue is the first to sound the alarm. Even more dangerous, a purple or dark red tongue. This may sound absurd, but in naturopathy, and increasingly in modern medicine, it is an indication of circulatory disorders or heart problems. The reason? Inadequate oxygen supply, and your tongue shows it before your heart does. Even small blisters or white spots should not be ignored. They can be the first signs of oral fungal infections, or in rare cases, even oral cancer, especially if they do not heal. In short, your tongue speaks, if you listen. In the following chapters, we will introduce you to 8 specific tongue changes, what they mean, and what you can do about them. But first, grab a mirror. Stick out your tongue. What do you see? Comment below. We read every message. And don't forget, subscribe to our channel, so you don't miss any of these invisible warnings. Your health starts right here, on your tongue. A slight whitish coating on the tongue sounds harmless, but for seniors, it can be the first sign of a more serious disorder. Especially if this coating does not disappear after brushing your teeth, but remains for days. Then it means beware. Your body is fighting, perhaps even against something life-threatening. The most common cause in older people is oral candidiasis, a fungal infection in the mouth. It is triggered by a weakened immune system, whether due to diabetes, antibiotics, cortisone, or age-related immune changes. A study by the German Society for Geriatric Dentistry found that over 55% of nursing home residents show symptoms of this infection, often unnoticed. But the white coating can mean even more. Chronic stomach problems, such as gastritis or heartburn, often first appear on the tongue. The body produces more mucus to compensate for stomach acid, and this settles on the tongue. If you also suffer from bloating, belching, or flatulence, you should take this combination seriously. In rare cases, the white coating is also an early sign of precancerous changes. In particular, leukoplakia, a white area that cannot be wiped off, is considered potentially malignant, especially in smokers or people with weakened immune systems. If you discover a stubborn white spot that does not go away, see a doctor immediately. What is particularly treacherous is that many seniors get used to this coating. It becomes part of everyday life. But what you see every day is easily overlooked. That is precisely why it is so important to take a close look. What should you do if you notice a white coating? Try to remove it carefully with a soft tongue brush. Does it remain? Have a dentist or family doctor take a smear test. Watch out for accompanying symptoms, such as burning, difficulty swallowing, or loss of appetite. The tongue is an early warning system, especially in older people, and white doesn't just mean clean. Sometimes it means help. Something is wrong. In the next chapter, we'll show you another dangerous warning sign, smooth, shiny tongues, and why they could be a dramatic cry for help from your body. Does your tongue look unusually smooth, almost as if it had been polished? Are the fine papillae that normally make it slightly rough missing? If so, Alarm bells should be ringing for seniors. A smooth tongue is often not a cosmetic detail, but a silent cry from your body for nutrients, protection, and attention. Medically, this is referred to as atrophic glossitis, the loss of tongue papillae, and the most common cause of this in people over a deficiency in vitamin B12, iron, or folic acid. These nutrients are essential for cell division, the formation of mucous membranes, and particularly important for the formation of collagen, nerve insulation, and blood formation. If they are lacking, the tongue is the first to be affected. It loses its structure, elasticity, and color. Part 1. An article published in 2019 in the journal Age and Aging showed that over 35% of seniors with neurological complaints, such as numbness, unsteadiness, or memory problems, also had a smooth tongue associated with a proven B12 deficiency. But B12 is only part of the story. Iron deficiency, which is common in seniors, especially in postmenopausal women, or people with chronic stomach problems, can have the same effect. The result: the tongue appears pale, burns when eating, especially with acidic or hot foods, and patients often report a foreign body sensation in the mouth. Also watch out for accompanying symptoms, such as tuzzy, chronic fatigue, brittle nails, or hair loss, burning feet, or numb fingers, pale skin, or shortness of breath. All of these are indications that the cause lies deep in the blood, and your tongue has long been warning you about it. What can you do? Have your doctor perform a complete blood count with iron, B12, and folic acid. Supplement your diet with natural sources: liver, lentils, oatmeal, eggs, and green vegetable. Avoid excessive alcohol consumption, as it further irritates the mucous membrane and blocks nutrients. Your tongue is not just a muscle, it is an early warning system for deficiencies that can be particularly dangerous in old age. Untreated B12 deficiency not only leads to fatigue, but also to irreparable nerve damage in the long term. In the next chapter, we will turn our attention to a particularly treacherous sign: cracks and furrows in the tongue, and why they can be much more than just age wrinkles. Have you noticed deep furrows, grooves, or small cracks on your tongue? Perhaps they run across or lengthwise, appear dry, or are sometimes sensitive. Many seniors see this as a normal change of age, but that can be a dangerous mistake, because a furrowed tongue is not always harmless. In some cases, it can be a warning sign of chronic inflammation, fungal infections, or even autoimmune diseases. First, the good news. Slight wrinkles on the tongue, known as lingua placata, occur in many older people. The reason: with age, the tongue loses tension and the tissue sags slightly. If the tongue does not hurt, and there are no other symptoms, this is usually harmless. But be careful: as soon as these cracks become deeper, sensitive, or even painful, you should take a closer look, because this can indicate a more serious cause. One of the most common causes is chronic oral candidiasis, a fungal infection that settles in the grooves and can spread undisturbed. This is not only unpleasant, it can lead to constant burning, difficulty swallowing, and a weakened immune system. But there's more. A cracked tongue can also be a symptom of Sjogren's syndrome, an autoimmune disease that destroys the salivary gland. The mouth becomes dry, the tongue cracked, and the mucous membrane prone to inflammation. Many sufferers report that they only experienced a dry mouth for months, until they were finally diagnosed. Another risk is nutrient deficiencies, especially vitamin B2, riboflavin, iron, or zinc. These lead to inflammation of the tongue mucosa, and the cracks become more severe. This is particularly dangerous if food debris accumulates in the cracks, as this can lead to infections and even chronic pain. What should you do? Does it burn when you eat? Maintain your oral hygiene with particular care. Gently clean your tongue with a soft brush. Drink enough water, at least 1.5 liters a day, to keep the mucous membrane moist. If dryness, pain, or white coating persist, be sure to see a doctor. A cracked tongue is not just a cosmetic issue. It is often the result of deeper processes in the body, and therefore deserves your full attention. This is because it is sometimes the first visible sign of a disease that otherwise remains hidden. In the next chapter, we take a look at an often overlooked warning sign, a dark red or purple tongue, and what it can reveal about your heart and blood circulation. Does your tongue look dark red, purple, or even slightly violet? Then caution is advised. This unusual coloration is no coincidence. It can indicate serious circulatory problems, heart failure, or chronic oxygen deficiency. And for seniors over 60, this can mean the difference between vitality and dangerous malnutrition. Normally, the tongue is pink and well supplied with blood. However, if it turns dark red or purple, this is a clear sign that something is wrong with your blood flow. A common cause is heart failure, i.e., reduced pumping capacity of the heart. This means that blood is no longer pumped efficiently around the body. Peripheral tissues, such as the lips, fingers, toes, and the tongue, are particularly poorly supplied. The result: they appear dark, sometimes even bluish. Chronic low blood pressure, vascular constriction, arteriosclerosis, or lung disease have a similar effect. This is because, as soon as there is a lack of oxygen in the blood, the color changes, first visible in well-supplied areas, such as the tongue. However, venous congestion, for example, in people with cardiac arrhythmia or untreated high blood pressure, can also lead to this discoloration. The blood congests, especially in the upper body and head area. The tongue appears darker, heavier, and sometimes slightly swollen. Another warning sign that is often overlooked is when the tongue is both dry and dark. This indicates insufficient saliva production, a symptom that is often associated with poor blood circulation in the salivary glands. This is particularly critical in older people with diabetes or smokers. What does this mean for you? If your tongue is permanently dark red, purple, or heavy, have your heart function, blood pressure, and oxygen saturation checked by a doctor. Watch out for additional symptoms, such as shortness of breath, swollen ankles, fatigue, or cold hands and feet. Exercise, contrast showers, and targeted cardiovascular training can improve blood circulation, but only in consultation with your doctor. Part 2. A color change on your tongue is more than just a visual effect. It is a subtle but clear warning sign, one that you should interpret in time before your heart or lungs are seriously in danger. The next chapter deals with an often embarrassing topic, but one that affects many seniors: the black, hairy tongue, and why it is related to medication, hygiene, and even the death of beneficial intestinal bacteria. Imagine looking in the mirror in the morning and seeing that your tongue is not pink and smooth, but darkly discolored, rough, and seemingly hairy. This phenomenon is frightening for many people, and yes, it often looks worse than it is. However, a so-called black hairy tongue is a clear sign that something in the body is out of balance, and it deserves special attention, especially in seniors. The technical term for it is lingua villosa nigra. The name sounds rare, but according to estimates, over 10% of older people experience it at some point in their lives. But what exactly is happening? The surface of our tongue is covered with papillae, small, finger-like protrusions. Normally, these are constantly being renewed. However, under certain conditions, they elongate, stick together, and accumulate color pigments, food residues, or bacteria. The result: a dark, sometimes black-brown tongue that looks hairy. This is particularly common in seniors with poor oral hygiene, people with dry mouth, often due to medication, long-term antibiotic therapy, which destroys the natural oral flora, excessive coffee, or tobacco consumption. Diabetes and certain heart medications, such as beta blockers or diuretics, can also dry out the mucous membranes, creating the perfect breeding ground for these black coatings to develop. And this is where the real problem lies. Although a hairy tongue itself is not dangerous, it indicates that your oral microbiome is disturbed, and this microbiome is directly related to your immune system, your digestion, and even collagen formation in old. This is because when disease-causing germs gain the upper hand in the oral cavity, the whole body suffers. Particularly affected are the heart, risk of endocarditis, the liver, toxin load, and due to the swallowing of these germs, the gastrointestinal tract. What can you do? Clean your tongue daily with a special tongue scraper or a soft brush. Let's increase hydration. Drink at least 1.52 liters of water daily to protect the mucous membranes. Support oral flora with probiotic foods or targeted supplements. Reduce sugar, nicotine, and black tea. They promote the growth of discoloration. If discoloration persists or you have a bad taste in your mouth, consult your doctor. A black tongue is not a death sentence, but it is a warning sign. It shows that your mucous membranes, digestion, and immune system need support. If you act now, you can not only stop the discoloration, you can also restore balance to the health of your entire oral cavity and body. The next chapter deals with an underestimated clue, the glassy, shiny, smooth tongue. What its lack of texture has to do with iron, B12 and dangerous deficiencies. If your tongue suddenly appears smooth and shiny, as if its surface had been peeled off, this is not a cosmetic problem. It is a silent cry from your body. I am missing something, and urgently. A glassy, smooth tongue, often referred to medically as Hunter's glossitis, is a classic sign of nutrient deficiency, especially in older people, and that can have dangerous consequences. Normally, the tongue is covered with small papillae that give it a velvety appearance. If these are missing, the tongue appears shiny, smooth, sometimes even varnished. At the same time, it may burn, feel numb, feel dry, or develop a metallic taste. The most common causes: vitamin B12 deficiency, especially in seniors, due to reduced absorption in the stomach; iron deficiency, often due to anemia, chronic inflammation, or poor nutrition; folic acid deficiency, often caused by medication, digestive disorder, or alcohol. The problem: these three vital substances are crucial for cell regeneration, the formation of red blood cells, and the supply of your nerves, muscles, and mucous membranes. If they are lacking, the tongue mucosa also atrophies, visibly and noticeably. And it doesn't stop at the tongue. Exhaustion, shortness of breath, concentration problems, tingling or burning in the hands and feet, brittle nails, pale skin, rapid pulse. All of these are typical side effects of long-term B12 or iron deficiency. What makes it particularly treacherous is that these deficiencies creep up over months and are often overlooked. According to a study in the Journal of Geriatric Medicine, 1 in 3 seniors over the age of 65 suffers from latent vitamin B12 deficiency without knowing it. A smooth tongue is one of the first visible warning signs. What now? FARD. Have a blood count done. Specifically check ferritin, iron stores, B12 and folic acid. FARD. Improve absorption in the intestine through a stomach-friendly diet, bitter substances, and probiotic support. Targeted nutritional supplementation in consultation with your doctor, e.g., B12 as lozenge or injections. Support tongue health with iron and vitamin-rich foods such as liver, lentils, oatmeal, beetroot, and fish. Part 3. A smooth burning tongue is not just a sign of aging. It is a visible reflection of your internal deficiency, and sometimes the only warning sign before dangerous anemia, nerve disorders, or chronic fatigue set in. In the next chapter, we look at an often underestimated sign that many ignore: white coating on the tongue. Is it just harmless oral flora, or is there a silent fungal infection behind it that can affect the whole body? A whitish coating on the tongue, especially in the morning, is dismissed by many as normal. But what if this coating becomes thicker, cannot be brushed away, or feels like milk, bread dough, or even matted? Then it could be oral candidiasis, a fungal infection that can have serious consequences, especially for seniors. The culprit: Candida albicans, a yeast fungus that is actually part of your normal oral flora. But if your immune system is weakened by age, medication, diabetes, or antibiotics, this fungus can get out of control. The result: a white wipeable coating, sometimes with a cracked, reddened, or even bleeding tongue. Seniors who are particularly at risk are those who wear dentures that are not cleaned regularly, use cortisone inhalers. For KPD or asthma, Reb have blood sugar problems, or have undergone long courses of antibiotics. What many people don't know, an untreated oral fungal infection does not remain in the mouth. When swallowed, the fungal spores enter the gastrointestinal tract, where they can cause inflammation, interfere with nutrient absorption, and further weaken the immune system. Typical symptoms of chronic candidiasis: constant cravings for sugar or bread, flatulence, fatigue, concentration problems, burning mouth mucosa, cracks in the corners of the mouth, recurrent infections or exhaustion. A study from the Journal of Oral Pathology and Medicine showed that over 60% of seniors with poorly fitting dentures had chronic fungal infections without realizing it. Their tongue was the first indication. What to do now? Reb use a tongue scraper regularly, but gently, so as not to irritate the mucous membrane. So drastically reduce sugar. Fungi love sugar. It's their fuel. Reb use shirt dentures daily with special cleaning agents. Reb use natural remedies: coconut oil, antifungal, cinnamon, oregano oil, or tea tree oil can help. For persistent infections, medical treatment with antifungal medication is necessary. Don't forget, your tongue is not just a sensory organ, it is a gateway to your inside. If it is coated with white, inflamed, or painful, this is often the first sign of a derailed immune system. Observe your tongue, clean it daily, and if you notice any changes, don't ignore them. They could be the first warning sign of a creeping illness. The next and final chapter provides an overview. What does your tongue as a whole, its shape, color, mobility, say about your heart, liver and intestines? The big tongue check for people over 60. Have you ever noticed that your tongue sometimes seems thicker, heavier, or even less mobile, or that it suddenly feels difficult to stick out of your mouth, trembles slightly, or appears asymmetrical? For many seniors, this is just a sign of aging, but in reality, it can be an early warning sign of serious illness. Severely swollen tongue that seems too big for the mouth can be a sign of heart failure. When the heart pumps less effectively, fluid accumulates in the tissue, including in the tongue. The result, a feeling of pressure, slurred speech, and in extreme cases, even shortness of breath when speaking or eating. SARD, a trembling or erratic tongue, especially in older men, can indicate neurological diseases, such as Parkinson's. Studies show that tremors often start in the tongue before spreading to the hands or legs. SARD, an asymmetrical tongue that deviates to one side when protruded, may indicate a mild stroke or nerve paralysis, e.g., hypoglossal nerve, even if no other symptoms are apparent. In this case, seek immediate medical attention, because time is brain. SARD, cracks in the tongue, longitudinal or transverse, are often considered harmless. However, if they are very deep, painful, or accompanied by fatigue and hair loss, this may indicate a biotin or iron deficiency. Both are essential for cell division and mucous membrane health. SARD, a deep red, shiny tongue with visible veins, especially at the edge of the tongue, can indicate liver problems or high blood pressure. In traditional Chinese medicine, the edge of the tongue is the liver area. Congestion or inflammation often manifest there. SARD, a furry or yellowish tongue, especially if it also smells bad, can indicate disturbed intestinal flora and digestive problems. It is a clear reflection of what is going wrong in the digestive tract. And tongue mobility is also crucial. A tongue that can no longer be moved in all directions may indicate neuromuscular disorders. An early warning sign of, for example, early stage ALS. Simple exercise. Stand in front of the mirror, stick out your tongue straight, move it to the left, right, up and down. Observe. Does it wobble? Does it tremble? Does it deviate? Tip. Perform a small tongue check once a week, in the morning, in daylight, before brushing your teeth. Make a note of any abnormalities. The tongue is often the only visible place where hidden diseases show up early, before blood tests or symptoms provide any clues. Because your tongue speaks, you just have to learn to understand it. If this tongue series has helped you, share the video with a friend or family member over 60, and help save lives by spreading the word. Subscribe to our channel for weekly health tips, specifically for seniors. Your health starts in your mouth. Take a look. It sounds dramatic, but your tongue can be the first visible organ to indicate cancer, especially for seniors over 60, whose immune systems are weaker, and cell changes are more likely to go unnoticed. Daily self-examination of the tongue plays a life-saving role. Small, painless sores or ulcers that last longer than 2 weeks, do not heal and occasionally bleed slightly, are a serious warning sign. Many people confuse them with canker sores, but in the case of malignant changes, these lesions remain persistent, often in the same place. White or red spots, especially on the edge of the tongue or under the tongue, should never be ignored. These so-called leukoplakia, white, or erythroplakia, red, are considered precancerous lesions, i.e., possible precursors to oral cancer. An examination by a dentist or ENT specialist is mandatory. Thickening or hardening of the tongue tissue that feels like lumps or even hinders tongue movement may indicate deeper tumor formation. This is particularly dangerous if it occurs on one side and is associated with pain when chewing or speaking, sudden numbness, burning, or a foreign body sensation in the tongue area without any explainable cause, should also be taken serious. They may indicate nerve involvement or tumor growth in the surrounding tissue. Changes in tongue mobility, such as when you can no longer stick your tongue out completely, or it pulls to one side, may also indicate damage from tumor cells or nerve involvement. Many of these symptoms are not painful at first, which is precisely what makes them so insidious. Pain often only occurs in advanced stages. That is why it is so important to visually check your tongue, preferably every day in front of a mirror, in good light. The good news: tongue cancer detected early is often curable. According to the German Cancer Society, the 5-year survival rate is up to 80% if the tumor is detected early. But the later the diagnosis, the more difficult the treatment, and the higher the risk of metastasis to the lymph nodes, or lungs. If you notice a conspicuous spot on your tongue that has not healed after 10-14 days, see a doctor immediately. No excuse. And don't forget, smoking, alcohol, poor oral hygiene, and HPV infection significantly increase the risk of tongue and mouth cancer, especially in older people. Something good for your tongue: avoid irritants, take care of your oral flora, eat a vitamin-rich diet, and listen when your tongue is trying to tell you something. In the next video, we'll show you which 5 morning routines strengthen your oral health, and how they can protect not only your tongue but also your heart, brain, and digestion. Subscribe now.